Great to see everyone. So today I'll just be talking about one of the studies in my dissertation, focusing on missed opportunities to provide online STI testing services through GetCheckedOnline. This was an interpretive, descriptive study of user experiences on the website. So just relating the study to the overall goals of the grant, specifically like Mark had described, we really wanted to understand as goal one, what works for whom and during and under what circumstances during scale up. And so I was really focused on understanding contextual factors influencing use and non-use of GetCheckedOnline and its program outcomes. Going back on the study that Shojo has just described, the 2022 client survey, we found that 1 in 3 users who intended to test when they created an account or reported needing testing when they created an account did not test at the end of the day. And we sort of defined that as a missed opportunity to provide testing. And we really wanted to understand what the role of the user experiences, the web design and implementation factors around the web design might play in the experience of missed opportunities. So we created specific definitions leaning on the literature at the time. So for example, web design refers to the usability of the interface and user experience of the intervention, while implementation refers to how we've organized services around the website. So that specific digital intervention. I really wanted to understand what role they played in people's experiences of missed opportunities. From the client survey at the time, we saw that people who said they experienced difficulties using the website were 3 times as likely to experience missed opportunities. While those who also, in terms of web design factors, just that one factor, but in terms of implementation, we found quite a number of factors. So for example, those who perceived the test on the web or available through the service as being inadequate, those who had preferences for self-sampling, and those who found it difficult to access a laboratory to submit specimen were more likely to experience missed opportunities. And these varied by different categories. So for example, people who earned less than $20,000 per annum who had difficulties with using the website were also more likely to experience missed opportunities, while women and immigrants who found it difficult to access a lab also found it very difficult to, or were more likely to experience missed opportunities. So we really wanted to understand. We know that the literature at the time suggests that, online postal self-sampling models have similar missed opportunities. In our previous work, we've also demonstrated drop-offs in the cascade. But we, in this model, didn't really know why people would be experiencing missed opportunities. So we asked specific questions around, first, how do clients who are unable to test despite intending to test describe their expectations and experience of the website's design and the implementation of services around the website, but also what could we be learning from their experience to reduce the occurrence of missed opportunities on the service. And so I conducted interviews over October 20, interviews in 2023. We purposely sampled people who had responded to the 2022 GetCheckedOnline client surveys who indicated that they experienced missed opportunities. These were people who had created accounts between October 2022 and February 2023, but had no records of testing. We did semi-structured interviews with 14 participants over Zoom, mostly at the time, and conducted a reflexive thematic analysis with a focus on equity. And we really based our analysis on a well-known equity framework called the Dover and Bellon Health Equity Measurement Framework, which suggests that there's a social stratification process that determines people's social locations in society that then influences their access to material circumstances and access to health services. We also based our analysis off of the unified theory of acceptance and use of technologies, which suggests that people's expectations of using the service, the effort they expect to dissipate while using the service, and the influences around the services influence their intention to use the service and eventually using the service. So in analyzing using these frameworks, we identified 3 main themes. First off was that the transition between GetCheckedOnline website and the laboratory testing services, including its website, was a major barrier for people trying to access testing through GetCheckedOnline. But in that barrier, there was moderation based on people's assessment of their circumstances and how GetCheckedOnline fit into their health and social context. But users also described opportunities to promote equity through tailoring the design and implementation of GetCheckedOnline to accommodate their varying needs. And so in terms of, the GetCheckedOnline laboratory transition as being a major barrier, what we found was that there were significant interoperability challenges between the website on GetCheckedOnline side and the partner lab services website. But also these challenges reinforced the sense that there were two separate organizations trying to achieve a common goal, but the fissures between both of them were apparent. There were also experiences, and these perceptions were painted by people's prior experiences with the website and prior experiences with the laboratory. And eventually, this transition was characterized by emotions of frustration and confusion. So, for example, this user described how the Get Checked Online part was pretty simple. He just filled the form. And then they were like, go to this address, clinic close to you. And so at that point, there was confusion around, is there going to be a line? You're going to have to reserve a spot at the laboratory. This wasn't clear, and eventually they dropped the idea of testing altogether. But even though people experienced these confusion and frustration at the transition, they could still potentially test depending on their context. And one of the things we identified was that people were actually active agents in their own testing, comparing Get Checked Online amongst a number of other testing options and seeing whether it meets their testing and treatment needs. We identified two main testing needs. We saw those who were urgent or concerned testers, so who had recent exposure or were concerned about a recent exposure and wanted testing to confirm their health status. And then there were those who were in precautionary states, who were more or less in entering into new relationships and wanted to, identify or establish a baseline. But even though they were trying to assess, and this would influence how they would assess GetCheckedOnline suitability to their context. But then people's risk perception also influence how they assess whether GetCheckedOnline met their needs or not. But where they heard about GetCheckedOnline and recommendations they heard about GetCheckedOnline influence whether or not they were able to persist to test or not test. So, for example, those who had heard about GetCheckedOnline from friends and family had increased expectations of the ease of testing, but reduced understanding of the steps required to test. Whereas those who had heard about GetCheckedOnline from their health service providers were very clear and understood the pathway to testing. And so this user suggested that because the healthcare provider they talked to had suggested that the steps they would get involved with testing, they felt like they had that in the back of their mind. So this was not really a problem in terms of trying to access testing. But then people's acceptance and trust also influence whether or not they tested and whether or not that transition we talked about was a bigger factor in their experience. So, for example, recent immigrants, people living in rural and remote areas who hadn't necessarily heard about Get Checked Online, except through Google searches, were not necessarily comfortable with proceeding with testing as compared to those who had heard about it through their healthcare providers. But more than anything, there were considerations around the resourcing required to access testing. So, for example, this user who lives in on the island suggested that I just kind of looked up the steps. I found that I had to go to Duncan, which is like half an hour drive from where I live. So it was just really hard to find a day in my work schedule where I could like drive myself over there to get that done. And it reinforced the sense that people who live or live and work in precarious situations may not necessarily have opportunities to test, even though the model supports or is intended to support those people. Finally, they described opportunities to get improvements in the testing. So I'll just highlight a few suggestions. So, for example, there were missed features on the website. When you sign on to the website, I've just circled there the four main steps involved in testing, but people routinely missed it because of the design cues, where the create account was the main feature that drew their attention, so they missed other items on the page. So, for example, when we did a walkthrough, of the website with users. A user was suggesting, we make information more apparent to people to help them know the steps involved in testing, but had apparently missed it. And so she was like, oh my God, you have it. I'm sorry. Maybe because I did my phone, it was too small. So just reinforcing some of those design cues that we need to be adapting for users. I'll just conclude with a few things. So, the web design contributes to perceived challenges in that main transition that we talked about. But more than anything, the implementation model imposes some resource demands on people that may not necessarily ensure that populations we're intending to reach can access testing in many contexts. And so addressing those needs will be important in ensuring equitable access to testing through GetCheckedOnline. We had many strengths in the studies, including our, focus on theory, but obviously we had a small sample that we need to be careful about extrapolating our findings to other populations. And then, of course, we're really focused on GetCheckedOnline's model. But there were things that, because of this integrated model where researchers and implementers are, working hand in hand, they've already taken, or the team has already taken up some of these findings and begun to implement changes like Heather had described. So, for example, developing personalized education material about the transition. So some of the videos, animated videos, to support users in making that transition more seamless. But there are additional design cues that need to be implemented on the website, like I described. But then also, we need to be considering alternative STI testing models, especially for resource constrained settings, rural and remote areas. I would like to thank you at this time, and then I'll stop for questions.